Welcome to the Nourished Child podcast, a show about childhood nutrition, feeding kids, and dealing with the ups and downs of growing a healthy child. Here's your host, registered dietitian and childhood nutrition expert, Jill Castle.
Hey friends, have you ever had a child who has been dizzy when they stand up, feels like they're going to faint, or might have some other issues like digestive issues, and you can't figure out what the heck is going on with them? Well, today I have a special guest. Registered dietitian Cheryl Harris is on the show, and we are talking about postural orthostatic tachycardia syndrome, or POTS. You might have heard about this condition with Olympic swimmer Katie Lydecky. It is something that teens might experience as they go through puberty, and it leaves a lot of parents with big questions as to what is going on with their kid. So we're going to demystify POTS in this episode, and I just wanted to share the reason why I wanted to bring this topic to you is that there's not a whole lot of education and conversation about this topic in the media or maybe even in the pediatrician office when you go and take your kid for a checkup. The thing that made me also want to do it was I attended a state meeting this past spring, and I listened to a presenter present the topic of POTS. And I literally sat in that audience and I was like, I think one of my kids has this. And so I've been on my own journey trying to uncover these symptoms and relate them to my child, my child who is now a young adult, but these symptoms started in college. And I just wanted to bring this to you, and I hope that it is inspiring, enlightening for you if you're a parent. And if you're a registered dietitian or a pediatrician who's listening to this episode, I hope it brings your awareness in terms of bringing your knowledge up to par and putting some of these tips and resources into your own toolbox. Without further ado, here's Cheryl, and I hope you enjoyed this interview. Hey everyone, welcome back to the Nourished Child. It's Jill, your host, and today's episode is for every parent who has a child struggling with dizziness, fatigue, or other unexplained symptoms that impact their daily life. Today, we're talking about POTS, or Postural Orthostatic Tachycardia Syndrome. While it might not be a household name for you, it's a condition that can affect children and teens. The good news is that nutrition and lifestyle strategies can make a significant difference. And today I have an expert on POTS joining us, Cheryl Harris. She's a dietitian with BS in nutrition from Cornell. I think your master's was done at UC Berkeley. And she works as a registered dietitian since 2003, and you're located in the Metro DC area. Mm-hmm. A specialty in digestive health. You have several specialties, actually, Cheryl. I was looking at your bio, but digestive health, gluten-free diet, POTS, obviously, and mindful eating and mindfulness practices. I saw some eating disorder work in there, some ARFID work. So you have quite an array of specialty areas, and I'm delighted you're on the show today, and welcome to the Nourished Child.
Thank you so much, and I couldn't be happier to be here.
Well, we want to really help parents out there understand what POTS is. And I know for myself, I had not really heard about it. I've not really worked with children with POTS or teenagers with POTS. And when I first heard about it at a conference, I was like, wow, I can think of a few people in my expanded family that might fit the bill on this diagnosis. So it's a real nice addition to this podcast show. I've never talked about this on the show before, so I'm ready to dig in. So for parents who've never heard of POTS, what or how would you describe it in simple terms?
Sure. So we'll pull apart the title a little bit. So postural orthostatic tachycardia syndrome. Syndrome is a collection of symptoms. Tachycardia is when your heart goes faster than it's supposed to. And posture is when you change from one position to another. So it's a collection of symptoms, including having your heart go faster than it's supposed to when you shift posture. And we'll, I'm sure, be talking about the range of symptoms that people may have.
I was just going to ask you, what are some of those common symptoms that parents might see in their children, and why are they so mysterious?
Yeah. And so the most common symptoms are tachycardia or rapid heart rate, fatigue, and concentration difficulties, but there are a wider pool of symptoms, including GI issues like nausea, abdominal pain, constipation, diarrhea. Also, very common are headaches, exercise intolerance, dizziness, and there can be other things like exercise intolerance. I think maybe we've said that one already. But there can be a wider range of symptoms, and some of them are pretty non-specific, and that can be part of why it can be so tricky to diagnose POTS.
Mm-hmm, mm-hmm. I would imagine, especially because it's a constellation of symptoms. And so it's not, you know, uh, necessarily the first diagnosis you go after, right? Because dehydration can cause a fast heart rate, right? Can cause you to feel dizzy. So when do we know this is more of a chronic situation versus just, oh, you didn't drink enough fluid when you were out on the football field playing, and now you're catching up and trying to be hydrated?
Well, that's a perfect question. The first thing is that in order to get a POTS diagnosis, the symptoms need to be chronic, so lasting 3 to 6 months. So you don't get a diagnosis of POTS for having these symptoms for a weekend that was really hot, or for just overdoing it, at the football game. It's when people have these symptoms on an ongoing basis, despite, hydrating well or through a range of different circumstances.
Yeah. And so when we think about sort of some of the scenarios where a child or a teenager might present, um, or might be experiencing these symptoms, can you sort of story tell or share some of the cases that you've seen, obviously without telling or sharing names, but some of sort of the different presentations that could be uh, associated with POTS?
Yeah, sort of a classic typical person with POTS. It most of the people who have POTS are actually female. It's 4 to 1 female, and most of the people who develop POTS are teens. The average age of developing POTS is around 13, so it's mostly going to be young women, although there are exceptions. Often it's people who have been very active, and it's people where they've always been, let's say, a soccer player or a runner, and then all of a sudden they start getting really fatigued. They can't do the things they used to, whether, as I said before, they start complaining of chest pain, their heart beating too fast. They can't they don't want to go out with their friends anymore. They start complaining of stomach aches. They don't want to eat the way they used to. And, you know, parents don't know what's wrong. They start going from doctor to doctor to doctor. And there's just the sense of something being wrong, and the child is just spending a whole lot more time in bed than they used to.
Mm.
One of the things that, as a dietitian, to me flags that maybe POTS might be common or on my radar is when I ask the question of whether someone feels better when they're upright or when they're lying down. Because almost all the time when someone has POTS, they feel better when they're lying down.
And that sort of ties in to that postural change, right? Like if you're lying down. So, what is it about lying down versus standing up that makes a teenager feel better?
The technical term is orthostatic intolerance, which is a fancy way of saying an intolerance to standing. Um, there's actually people with POTS tend to have actually literally less blood volume. And so when you're lying down, it's easier for your blood to get to your heart and your brain. And obviously your heart and your brain and everywhere else needs oxygen. And then as soon as a teen or anyone else stands up, all of a sudden your heart and your head doesn't get as much oxygen as it needs to. And so then the heart has to work really hard and increase your heart rate to get to pump blood up to the heart and the head. And that rapid increase in heart rate, first of all, causes that tachycardia, but it also can cause those things like dizziness if there isn't enough oxygen and blood going up to the head. So that can cause a lot of the symptoms that we associate with POTS.
So the lightheadedness, is that something that is sort of fleeting, or can that be more serious in some individuals, leading to fainting? Or I've heard of people passing out. I've heard of I'm thinking of one of my family members who every time they stand up, they just have to pause and like sit on the edge of the bed for a few seconds to feel normal before they stand up.
Yeah, most of the time, people feel like they're going to faint, but don't actually faint. There are some people who do pass out. All of that being said, I think one of the caveats I want to give is that POTS falls under the umbrella of something known as dysautonomia. Dysautonomia is a fancy word for dysfunction of the autonomic nervous system. And POTS is just one of a range of types of dysautonomias, and some of the others, and one of them is known as vasovagal syncope. And in that one, people do pass out. So if you have a teen or a family member who is passing out, they may not have POTS, but they may have sort of like a cousin to POTS. It's still absolutely something to be on top of, and it is still something that can be addressed by diet and lifestyle. It may not be POTS per se, but it's still something where diet and lifestyle can make a difference.
So you did a nice explanation of what is happening in the body when a child is experiencing some of these symptoms in terms of blood flow. And when we make a diagnosis in a child or a teen, actually, before I ask you that, I want to ask you, why the teenage years and why girls?
And the answer is the same: hormones and hormones.
Hormones and hormones. Okay.
Well, so the belief is that there are a range of causes of POTS that we know. The number one cause of POTS that's been identified is actually viruses, and that's not age specific. But many of the other causes are stress related, like surgeries, like traumas, like even like a car accident or a concussion. But many of the other things are simply hormone related, like puberty, like pregnancy. And teens are often the ones that are more likely to get things like concussions. And of course, puberty and hormone changes are much more common to happen to teens than people of other age groups, of course. And so for about half of people with POTS, there's a known cause. And for the other half, people aren't aware of the triggers. But most of the people who develop POTS are in the teen age years.
And is this something that once you've developed it, it's chronic, you have it for your lifetime, or is there a treatment to reverse it, or is it more of a, you just have to alter your diet and lifestyle to manage it?
It's a really wonderful question. There are treatments. For most of the time, there isn't a cure. So if POTS is due to an underlying illness and someone can address the underlying illness, there are times where it does resolve entirely. Most of the time, like 90% of the time, according to a study on teens, people need to either change their lifestyle, diet, or take medications long term in order to manage symptoms.
Okay. So let's talk about the diagnostic process. What leads or what kind of testing do individuals need to undergo in order to gain a diagnosis of POTS?
Sure. There's something that's known as the Nasoline test. It's also known as the poor man's tilt table test. It's something where you lie down for 10 minutes and then you stand up, which is really quite simple. People can do it at home, and I can link to where you can either do it at home or give the instructions to your primary care doctor if they're not familiar. And essentially, it's measuring the change in the heart rate going from lying down to standing, and then seeing if there's a jump in heart rate. It's also seeing if there's a major change in symptoms, because if someone typically just goes from lying down to standing, nothing should really shift. But in someone with POTS, there's often all the symptoms we talked about before in terms of the tachycardia and the dizziness and the weakness. And as you mentioned, the family member who has to sit on the edge of the bed, otherwise they feel like they're going to pass out. Obviously, that's not typical. So the quote unquote poor man's POTS, poor man's tilt table test, or the Nasoline test, is one test. Large major medical centers also have what's known as a tilt table test, which is a major piece of medical equipment that's a much more formal test. Most medical centers actually don't have that, but that's another way of formally doing the test.
Are most, well, maybe not say most, but are pediatricians aware of POTS, in teenagers? Is this a conversation that might readily come up when you go into your pediatrician with your child and you say, my child is tired all the time, they're sleeping all the time, they feel dizzy when they stand up? Is a pediatrician thinking off the top of their head, oh, it must be POTS, let's look at that? Or are there other things like fatigue and laying in bed? It's like, well, is there depression? Is there, there's other things that I think healthcare providers might come to mind before POTS.
Yes. And so I do think that many providers would think of other things first. And I think that doctors are starting to learn more about POTS. It's also been documented that among people who have been diagnosed with POTS and among teens who've been diagnosed with POTS, over half of them were initially told, quote unquote, it's all in your head. So that's part of why it's so important for parents to be present and to advocate, because a lot of times both teens and adults are initially dismissed with their concerns, or told that it's just psychological, even though POTS is a physiologic condition. It's not a psychological condition. But there have been papers in the biggest journals, like Journal of BMJ, JAMA, like the largest and most reputable journals there are.
It's the symptoms can be so subtle. And I think that's probably why, you're thinking, is this something going on with the brain, or is this a psychological issue, especially in teenagers who are, mental health is such a concern these days. And I can see how it can be confusing to get to a solid diagnosis, but it's refreshing to know that there's a pretty simple test that you could do even at home. So I'd love to share that link with the audience in the show notes. If you think about like athletes versus non-athletes, is there any sort of data or suggestion that we see this happening in an athlete more so than in sort of a non-athletic teenager, or is that not anything that you've seen?
There used to be an idea that POTS was caused by deconditioning, meaning that POTS was in people who are not athletic, and that's not the case. That's been disproven. Katie Lydecky, who's an extremely athletic Olympic swimmer, has publicly spoken about having POTS. So you can clearly be an elite athlete and have POTS, but the the flip side isn't necessarily true that everyone who has POTS is, necessarily an athlete.
Yeah.
So I'm in terms of that being the case, not necessarily.
It is interesting to me. I'm glad you brought up Katie Lydecky, because I did see that
Yeah.
somewhere in passing. And my thought was, gosh, in an athlete, you would think that blood flow was pretty darn good,
Yes.
right? You would just think that the vessels were highly functioning, that blood flow was not an issue in an elite athlete, but it still can be, which ties back, I guess, to the dysautonomia that you were describing before, that there's some dysfunction. It has nothing to do necessarily with the physical status of the vessels, but it's deeper than that, I guess.
Yeah, and quite frankly, I haven't read enough to know when in her journey that Katie developed that and how she worked with that diagnosis. But one of the things in terms of POTS is one of the things that's recommended is what's known as recumbent or lying down exercise. And swimming is a perfect example of the kind of exercise that's encouraged with POTS if people are able to make it work. So things like swimming, a recumbent bike, Pilates. And so I'm imagining that something like marathon running would be quite, rather much harder for someone with POTS. But
yeah, it's interesting because the family member that I mentioned was a swimmer,
mm,
and I suppose many of the symptoms got magnified when the swimming career ended.
yes.
Which would make a lot of sense based on what you're saying. Yeah. All right. So let's talk about, let's say, a teenager. You're a parent of a teenager. They've been diagnosed with POTS. Now what? What is the treatment? What is, what are we looking at in terms of managing those symptoms?
Gotcha. So first line treatment is lifestyle. That's fluid and electrolytes, and then we'll get to the others in just a minute. So a lot of it, what I was saying before in terms of, people with POTS having what's known as hypovolemia or lower blood volume. So with fluid and electrolytes, the goal is to expand blood volume.
Mm-hmm.
So that means both having a lot of fluid, so 2 to 3 liters of fluid at least, and also the electrolytes so that that fluid is actually like held in the body. So it's not just like you have a lot of urine. So, and in terms of the electrolytes, that's either just salt and like a lot of salt, or it may be electrolytes. And exactly how much is going to depend on the medical conditions that people do or don't have. It may be a very high amount, or if someone has cardiac issues or renal issues, it may be a lower amount. And so that's going to be, worked out with someone's medical team. That's why I'm a little hesitant to give amounts, because people have their own medical issues that they're juggling. But it is always by starting off by increasing fluids and increasing salts. Most people, and I'm assuming most teens, aren't having a lot of alcohol because alcohol tends to make things worse.
Mm-hmm.
Caffeine usually makes things worse. Occasionally will make things better, but most of the time makes things worse.
Hey guys, I just want to take a quick break and encourage you to subscribe to this show. And if you can, share it with just one friend. Whether you do that on YouTube or you do it on your podcast app, I would greatly appreciate it. And I also want to invite you to join my newsletter called The Munch, MUNCH. You can simply go to thenourissedchild.com/munch and sign up. Also, don't forget, thenourissedchild.com has tons of information for you about nutrition for kids and feeding them, and I hope you will find it a useful resource. Okay, let's get back to the show. So, for parents who are listening, if you are managing POTS in your child, you're not going to be careful about sodium intake. Because the public health messaging is, low salt, be careful with your sodium intake for your cardiovascular health. But in this condition specifically, higher amounts of salt are what is really going to help keep the blood volume at an optimal level and keep the symptoms at bay.
And it often is pretty high amounts of salt. And that's gonna be something that either you'll be working on with a dietitian or with your doctor. And sometimes it's just salt in or on foods. And sometimes teens need to actually have electrolyte or salt packets. So sometimes the amounts are really quite high.
Mm-hmm. So it's depending on the individual and how that individual is responding, it sounds like, to the addition of salt.
Yep.
And okay, alcohol. Let's dive into that a little bit because unfortunately teens are drinking alcohol. And so I imagine you said it makes it worse. What is sort of what's the why behind alcohol making POTS worse?
A lot of it is that, while alcohol is a fluid, it's going to often overall be dehydrating, meaning people will lose more fluid. So they may feel fine while they're drinking, but afterwards people are going to end up your teen's going to end up being more dehydrated. So your poor teen is going to end up feeling worse than their peers afterwards. And so the impact on them is going to be disproportionately worse. And so, even when I'm working with teens, I really do try to to emphasize that the cost for them is going to be worse. They're not going to feel good afterwards.
So does that look like lying in bed all day the day after because they just feel so fatigued and out of balance and dehydrated, or is that what we're talking about?
Yes.
Yeah.
And it's
So,
knowing that if they're going to drink, making sure they're having much more in the way of fluids and electrolytes the next day. But it's knowing that staying in bed and being sick and dehydrated the next day and not being able to go out and do anything with their friends is not a good time.
yeah. Yeah. So it sounds like salt is very important, added salt.
Yes.
Are there any other nutrients or foods that you find you are recommending your patients consume um, when they're managing the symptoms of POTS?
So there are a handful of things. A lot of times when people have POTS, 90% of people with POTS have gastrointestinal issues. So that's a pretty hefty number.
Yeah.
So most of the time when I'm working with patients with POTS, rather than let's say saying eat one food, don't eat another food, we're more of managing whether it's irritable bowel syndrome or reflux or constipation or we're abdominal pain, whatever it is, we're managing specific symptoms. And the other caveat I really want to give is that when they did the only one survey they did on teens and disordered eating, they found that 75% of teens met the criteria for disordered eating. So I try to be really conscious when I give food advice because that number is astronomical. And they haven't done any follow-up surveys, even though I really wish they had, because that's to me really deserves attention.
Sure. So, okay, let's unpack both of those statistics a little bit more. The 90% of teens with POTS have GI issues.
It's 90% of people. They haven't done specific.
Okay, 90% of people.
Yeah.
I'm less concerned about the number, more concerned about the GI issues.
Yes.
So, what are we talking about? You said constipation, you said diarrhea, you said IBS. Reflux,
nausea, vomiting, gastroparesis. Yep, the whole 9 yards.
And so, how is that connected?
That is a good question. We are not 100%. A lot of it is that hasn't. Okay, we are entirely certain that they are connected because the number is extremely high.
Yeah.
Some of those things some of those symptoms actually improve when people lie down. So some of the symptoms are considered, as I said, like postural. Some of those symptoms actually improve when people have more fluid, when people have more salt, when people take the quote unquote POTS medication. So some of the things improve when people do quote unquote standard POTS therapies. And some of the things are independent. And so, so some of the things seem to sort of track along with the hypovolemia. And so essentially, when I have a patient who's nauseous or vomiting, rather than doing the sort of normal nausea and vomiting things, I actually have them try to up their salt, which sounds like a very strange thing. So rather than treating the nausea and vomiting outright, I treat the POTS. So it's sort of a kind of interesting thing. But if someone is, let's say, constipated, I would be much more likely to try to address the constipation.
The fluid piece of it. Yeah. So I imagine that you ask, if somebody's coming to you with POTS, you're asking about their GI symptoms.
So it is uncommon to see someone with POTS who doesn't have GI symptoms.
Do they make the connection typically between their POTS and these GI symptoms, or is it sort of like oh yeah, and I I have to run to the bathroom 3 or 4 times a day, I get diarrhea, or I'm always constipated, or are they making that connection, or is it you, from your clinical knowledge and your experience with POTS, that you're asking and then you're connecting it for them?
It's knowing that when I mention it, a lot of times they're saying, "Oh, I knew that, but my doctors," or something like that. Like everyone said no, but I knew it all along.
Oh,
Because it sounds sort of strange that let's say the heart palpitations and the let's say nausea or the constipation are related. For people who aren't necessarily well versed. But especially when for most of the teens or for most of the people, those two things show up together.
It must be incredibly satisfying or eye-opening to have all these symptoms, which are so subtle and probably baffling for a lot of people, get wrapped up into one package called POTS.
It can be extremely satisfying to understand how the things are related. And for many people, even just understanding, especially when there is such a high rate of people being told, no, it's your imagination, it's just depression. And I'm not trying to diminish depression. Depression can be extremely debilitating. But when people have the sense of what's going on is physiologic, these, or when people don't feel depressed and these things keep happening or even happening when they're happy, it can be very disorienting. And so to understand that there is a physiologic basis and that it can be treated with lifestyle, with medication, can really be both validating and empowering.
I want to circle back to the disordered eating statistic. Sure. You said 75% of individuals with POTS have disordered eating. What is, for parents out there, they hear the term disordered eating, and it's a very scary term because we know it can be that precursor to an eating disorder. But what does the disordered eating specifically look like as related to POTS?
A lot of times when people have POTS, different people tell them, oh, go on this diet, go on that diet, or simply because they feel bad. They're fatigued, something hurts, whether it's their GI system hurts or they're having whatever kind of strange pain or strange symptoms. A friend tells them to go on whatever kind of diet, or name your social media site tells them to go on whatever diet, or they see a plan on whatever saying, well, I had X and I did this and I got better. And it may simply be because they just want to feel good again. And so a lot of times it makes so much sense. Teens just want to feel normal. They want to be back to living their life. They want to feel good. And that it's as logical as anything could possibly be.
Yeah. Yeah. So it's mostly dieting, I think, is what I'm hearing you say. Yeah.
But it may not be quote unquote dieting with a goal of weight loss. It may simply be dieting with a goal of symptom management. And in
Yeah.
many cases, that is what's happening.
Yeah. Yeah. Relief, looking for relief. Yeah.
Yeah.
So, I imagine when parents hear increase the sodium in your child's diet, that can look like salt shaker on everything that you're
Hmm.
eating. It can look like, as you mentioned, packets of salt. But some parents will say, okay, this might be a green light for more fast food, more, you know, um, ultra processed, high calorie, high fat, low nutrient foods. Um, how do you advise families to help their children consume more sodium while also maintaining um, a nutritious diet?
Yeah, and it's really interesting when I'm hearing you say that because I haven't encountered um, so many examples where people just sort of say like, okay, well, we'll have more, unprocessed, more processed this, that, or the other. Even though there are times where people say like, okay, well, I'll have a bag of potato chips and or this, that, or the other. A lot of times people do really start seeing, oh, when I have this, I feel better. When I have that, I feel worse. Especially when teens are feeling worse, they're pretty perceptive in terms of noticing how their bodies feel. I find that teens are often more aware than sometimes adults are,
Hmm.
and and a lot of times they want to feel good so they can spend time with their friends. That's an intrinsic motivation.
Hmm.
Um, and what we know is that overall, a lower glycemic diet, teens or people tend to feel better.
Hmm.
And that is what many people notice. The caveats that I do want to give are that in the general population, 1% of the population has celiac. In the people with POTS, it's 4%. So before people change their diet or before you have your teen change their diet, it's always worth having your teen tested for celiac because the numbers are so different. So if your teen is contemplating a significant diet shift, that's one to rule out.
So, what I heard you say is that 1% of people with POTS, or 1% of the general population have celiac disease, but in POTS, 4% have celiac.
Yep.
So,
So a lot of times one of the first things people see on the internet is go gluten free.
mm,
Except there isn't the caveat of, hey, there's a 4 times higher risk of having celiac disease. So if that is something that your child encounters or something that is being considered in the mix, I am putting that caveat out there just so that that's something
yeah.
that gets checked off on the list.
Yeah. And is the reverse true? If you're a parent of a child with POTS and you're noticing some of these GI symptoms, should that child also be checked for celiac?
Hmm.
Yeah.
Yeah,
Yeah.
for sure.
What about the child or the teen who doesn't like to drink
Oh,
fluids?
it's
How
so
do you
hard.
advise those families? Because they're out there. I know.
It's so hard because that was me. Um, a lot of it is, and so it's the things that are fluid but don't look like fluid. And so a perfect example would be, melons, or something where it's like it's fluid, but
It's
it's most
solid.
exactly it's fluid, but it's solid at the same time. So there are people who wouldn't drink a glass of water, but they would have a smoothie, or they would have soup, or they would have something that's flavored.
Mhm,
So it's going to be sitting down with your kiddo and saying like, okay, what's workable? What
mhm,
would you aside from alcohol, like what is the yes? What kind
mhm,
of fluid will you consume? Or what that is an extremely high water content? Would that be watermelon? Would that be tomatoes? Would that be melons? Would that be cucumber? What can we add to water to make it workable? And
Mm-hmm.
there are so many things that, teens are like the ones who gravitate toward the gadgets. So like the apps that you do the things and you get the points and the stars and the this, that, and the other, or the
Mm-hmm.
water bottles that light up so that it's fun and it's whatever. So those are often the things that make
Yeah.
either drinking or consuming fluid
Yeah.
more
What do you
workable.
what do you think about all those hydration packets you can add to water? Do you find that your clients gravitate towards those? Like the IV hydration packets or the body armor electrolyte packets. They're mostly geared towards athletes, right? But I would think that maybe in this case it could be a beneficial addition.
Yeah, so there are certain ones that
Mhm.
have the World Health Organization electrolyte formulas. Normalite is one, Drip Drop is another. So there are a handful of ones that are mostly salt that have a handful of like just like a teeny bit of sugar to increase the salt
Mhm.
transport. And so the World Health Organization formula is basically like the magic term. It says that on their website of whatever ones. I'm not a really big fan of liquid IV, and the main reason is that the B vitamins, if you're having it only once a day, it doesn't matter. But a lot of my patients are having the packets multiple times a day, and
Mhm.
if you're having it multiple times a day, the B vitamin content is higher than I would want my patients to have.
Yeah.
But using as a general rule, ones that use the World Health Organization formula would work just fine. And it's knowing that you can just Google and find that formula, and you can also make it at home.
Yeah. Yeah. Um, so, just one or two more questions. Let's just talk about other lifestyle changes. We've kind of dove in on the nutrition stuff, but movement, sleep. You kind of mentioned earlier more of those recumbent exercises, Pilates, swimming.
Yeah, and thank you so much for bringing us back around to that. There are structured POTS protocols, Levine, Dallas, CHOP, Utah, ADAPT. And those work really well for a lot of people with POTS. I also want to give the caveat that when they've done trials on those, about half of the people have done really well. And there's also like half that are dropped out because they haven't been able to do them because
Hmm.
it's too much.
Mm.
So it's knowing that if your teen starts and they either can't keep up or they start doing worse, absolutely make sure your kiddo is working with a physical therapist or an occupational therapist and that they're going at their speed
Hmm.
because it's not your kiddo doesn't need to be going at someone else's pace and doing someone else's thing. They need something that's tailored to them, and if it's too much, it's not going to help them.
Yeah. Yeah. That makes a lot of sense. Where can parents find reliable, evidence based information about POTS and its management?
Sure, Dysautonomia International is a wonderful site, and I'll give you that link so you can put it in the show notes.
Awesome. Any last words, parting words, or messages you want parents to hear to sort of wrap up this conversation about POTS and symptom management?
Sure. So obviously, teens want to be spreading their wings, testing their boundaries, but they absolutely, absolutely, absolutely need to depend on their parents, even if they don't want to or don't want to acknowledge it. And having their parents there, having their parents ask questions, stay on top of things, being supportive, being present really makes a difference when kids have complex issues. So being there, being present, doing all the things, even being where your kids want you to be, letting them set the pace, letting them, let let you know where and how they want you to help, but being available because it really will make a difference for them.
Yeah, great. information and advice. Cheryl, thank you so much for coming on and talking about this condition that I think is going to be really eye-opening. Where can families find you if they're listening to this and they're like, oh, we need to talk with Cheryl about this? Where can they connect with you, possibly even work with you?
Sure. So on my website, harriswholehealth.com, that's my website, and I have information there. I do have info on POTS as well, if it's something that people want to read up more on.
Okay, great.
And
Well,
I'm so appreciative that you chose to focus on this more because it is such an important topic.
I think so. And I think we're seeing more and more. I feel like I'm seeing more teens struggle with it and not have a diagnosis. So this is great for families to just kind of get the basics and rule in or rule out based on the information you've shared, whether they need to go talk to their pediatrician about concerns that they have. So I really appreciate you sharing your expertise. Folks, if you enjoyed this show, make sure that you go to your podcast app, like the show, follow. You'll be able to watch this on YouTube as well. Cheryl, thank you so much. Folks, parents,
My pleasure.
make sure you give that child in your life a loving squeeze today. Bye for now.
Bye.
I hope you enjoyed this show. I surely did. Cheryl's a wonderful resource. You can find the links to her website and some of those resources we discussed in the show. You can find those links on the blog over at thenourished.child.com. You can also find them on YouTube, where you can watch a video of this conversation. She has included some of the articles we talked about, as well as the self-diagnosis methods that you can use at home, and several other resources. If you like this show, if you listen to it, please rate it on your app, wherever you listen to podcasts. Write a review if you have a minute or two. And again, remember, I always appreciate your support and your listenership to this podcast. I've been doing it for almost 10 years, and when I get feedback, it really helps me stay motivated to keep on going. In the meantime, and until the next time we meet again, make sure you give that child in your life a loving squeeze today. Bye for now.
Thanks for listening to the Nourished Child podcast, where the #1 goal is to help you grow a nourished child inside and out.